Hello everyone. In today's video, we are going to discuss about the various dimensions of health under the concept of health and disease. Now, let us start with the dimensions. What are the dimensions? Dimensions are nothing but the features which comprise the health, or you're measuring the health. The measurement of the health can be done in various aspects. The most important is this triangle, that is physical, social and mental. These three are the important ones. Along with that, we have spiritual, emotional, and additional to that, environmental, vocational, cultural, and so on, which we'll be discussing in the upcoming slides. I hope it's clear, guys. What is dimension? Dimensions are nothing but the measurement of the health in terms of physical, social, mental, emotional, spiritual, and so on. Let us start with physical dimension. What do you mean by physical health? Physical health implies the idea or notion of perfect functioning of the body. Physically fit person. Physical health means there is a perfect functioning of the body. It's an idea that the physical health, there is perfect functioning of the body. It is a state in which every cell and every organ of the body, so the every cell of the body and the every organs of the body are functioning at the maximum capacity. Optimum capacity is nothing but at its maximum capacity, and there is a perfect harmony with the rest of the body. So the entire body is in a harmony and the cells are performing at its optimum capacity, is nothing but the physical health. I hope it's clear. Moving on to the signs of physical health. If a person is physically fit, so to assess the physical health, you can assess on yourself. Let us check how healthy we are, how physically fit we are. A physical health, a person who is physically fit will have a clean skin, bright eyes. He's not too fatty, there is no obesity, his BMI will be perfect, a sweet breath, a good appetite, sound sleep, regular activities of bowel and bladder. He has no problem in the passing urination or the stools. So there is a regular activity of the bowel and bladder. He is free from constipation and so on. Smooth, easy and coordinated bodily movements will be present. Okay guys, so I hope the physical signs are very clear and it's very simple to understand. Clean skin, good complexion, bright eyes, lustrous hair, and then the person won't be obese, he has good appetite, sound sleep, good activity of bowel and bladder. Moving on to the mental dimension. I hope physical dimension is clear. Moving on to mental dimension. Mental health is not mere absence of mental disease. Just because I'm not mentally challenged, it doesn't mean that I'm mentally healthy. They mean that you should have certain characteristics which you have to fulfill to be called mentally healthy. Now let us see what they say. Mental health has been defined as a state of balance between the individual and the surrounding world. So you can see there is a balance. The balance is present between the individual and his surrounding. This balance has to be maintained. A state of harmony between oneself and also the other people. He has a harmony. Between him and the other people, there is harmony as well as a balance which is present. Researchers have discovered that psychological factors can induce all kinds of illness, not just the mental ones. There are also the physical illnesses, pathological illnesses which the patient faces because of the deprived mental health. What are those? They include essential hypertension, obviously, peptic ulcer diseases because of the stress, anxiety, and then lifestyle disorders. Mentally they'll be suffering with so much of stress and everything, and then bronchial asthma, These are the conditions the mental abnormal mental health can result in. Some major mental illnesses such as depression, schizophrenia. Schizophrenia has a biological component. So I hope the mental dimension is clear. Mental dimension, what do they say? It is not just the absence of mental illness. There must be a balance between him and the surrounding, harmony between him and others. And the other illnesses can also occur because of the abnormal mental health. Those are hypertension, peptic ulcer, bronchial asthma, depression, schizophrenia, and so on. Moving on to the characteristic attributes of mentally healthy person. A mentally, now let us assess ourselves again. Now physically you did a assessment on yourself, looking if you have a good body, if you are physically fit, or you should work out, and if you're obese, try to bring in a good BMI and everything. Now let us assess ourselves mentally, how mentally fit I am. A mentally healthy person is free from internal conflicts. He is not at a war with himself. You are struggling with your own self, then you are not mentally fit. You should be at peace with oneself. You should have contentment about oneself, happy, satisfied, then you are healthy, mentally healthy. A mentally healthy person will be well adjusted. What do they mean by well adjusted? He will get along well with others. He's not grumpy, having that attitude, wants solitude. Not like that. He mingles easily with people. He gets along well with others. He accepts the criticism and is not easily upset. A person just says, like casually, the friendly behavior will be there. He won't take criticism to his heart. He will just, accept the criticism very well and will not be upset very easily. He searches for identity. He sees himself as a member of the society. He knows himself, his identity. He looks for it. He has a strong sense of self esteem. He knows himself, his needs, his problems, what are his goals in life. That is known as self actualization. What is the mentally healthy person? Mentally healthy person will accept the criticism well. He will look for identity, good self esteem, and self actualization will be there. Once we start with self actualization, there the progress of a person starts. Now once I know what are my goals in life, I'll start to work towards them. I become mentally healthy. For it, I become also, the physical health will also be improved by that. He has good self control, balances the rationality and emotionality. He faces the problems, tries to solve them very intelligently. He copes with the stress in the society as well as the anxiety what he is facing. So a mentally healthy person will be taking up the stress very well. He will not be affected by any type of anxiety and all such disorders. Anxiety disorders, depression and all, he'll be fit. He has the self actualization, good self esteem, and has a good productive a productivity to the society. Moving on to the social dimension. It has been defined as the quantity and quality of individuals' interpersonal ties. So here they are not speaking about the social media. It's not about the WhatsApp, Twitter, Facebook, IG. It's not about that. Here they are talking about the individuals' interpersonal ties. You can see the individual's interpersonal ties and also the extent of involvement with the community. That is nothing but the social health or the social dimension. How do we assess this? The level of social skills the person is possessing, his functioning in the society, how is he helping the society, what role is he playing as a member of the society, is he seeing himself as a member of one of the member of the society, is he considering himself as a member. That is nothing but the social health. What skills is possessing, what is his function in the society, and the ability to see oneself as a member of society is nothing but the social dimension. Moving on to the spiritual dimension. Now we have dealt with the three major things: physical, mental, and social. Social, very important, you have to remember, is the interpersonal ties and the involvement with the community. Okay, the society and the community. Moving on to the next one is a spiritual dimension. Spiritual health refers to the part of an individual which reaches out and strives for meaning and purpose in life. Here comes the supernatural power which we believe in, somebody higher to us. Here they mean about God. Okay, spiritual is nothing but God. Now we also, it's not just related to God, it also includes the purpose. Once the person starts finding what is his purpose on this earth, why has he been put on this earth? What is the meaning of life? What is the purpose in his life? Then he is reaching the spiritual health. It will include the integrity, the principles, the ethics. So we believe we have the morals, we have the ethics. We just do not roam around doing the murdery, robbery, burglary, all such things we don't do, because we have certain principles, ethics. We fear the supernatural power, the unseen power, which is nothing but the spiritual health. This is the spiritual health which is making us to be a good human in the society. We also focus on the purpose in our life, the commitment we have to some higher being, the prayers, the chanting, all such prostration, what you're doing to the God is nothing but the spiritual dimension. It is the principles, ethics, the purpose in life, and the commitment what you have to some higher being is nothing but the spiritual dimension. Moving on to emotional dimension. Historically, sorry guys, the mental and emotional dimension is seen as one element. So, they used to consider the mental and emotional dimension as one element before, but now there is a clear difference between the two. Mental health is nothing but the knowing and cognition, it is related to the intellect, whereas the emotional health is related to feelings of a person. Okay, now let us see the emotional health is including. Now let us start assessing ourselves again. Another test for ourselves. Physically we saw if we are fit, then we saw mental health. Now let us assess ourselves how fit we are emotionally. A emotionally healthy person has a positive thinking. He is capable of coping and adjusting self. How positively do we think? This is the first point. How positive thinking a person possesses. Emotionally healthy person will have a good positive thinking. He will be an optimist. A emotionally healthy person will participate in all the activities which are related to the personal growth, and also the activities which will enhance his self-esteem. He will take a voluntary participation in that. Emotionally well people have the ability to express the feelings freely. They manage the feelings effectively. So a healthy person, emotionally well person, if he is criticized, he will open up. He will tell his problems, what he's facing. If he's hurt, he communicates well, expresses his feelings well. He will be optimistic in his life. So he expresses the emotions, his feelings freely, and he also can manage the feelings effectively. For an example, a person who is rejected, he what does he do? He doesn't hold on to the grudges. He accepts his fate, his reality, and then he accepts the feelings very nicely. He tries to express his feelings. If there is no reciprocation, then he will manage the feelings very effectively. He is a emotionally healthy person. Not like, okay, she rejected me, I'm going to throw some acid on her, burn her off her face. All such are not emotionally healthy people. So just assess ourselves, how emotionally healthy are we? Do we hold such pessimistic attitude, the grudges, bad emotions? If it is, let go, become emotionally healthy. They're also aware of and accept a wide range of feelings in themselves and others. So they are aware of themselves and also the feelings of others. They understand others. Emotionally well person doesn't hurt others. He understands the emotions and feelings. He is able to differentiate the feelings. Moving on to the vocational dimension. Vocational dimension all deals about your career, your work, job, all such. Work often plays an important role in promoting the physical as well as mental health. So imagine guys, an unemployed guy. Will he be physically fit? No, he'll have a very sedentary life, sitting at home, binge watching, and then sleeping all day. So he'll go into obesity. He won't be physically fit. Mentally, how can he be fit? He will not have self confidence. There's low self esteem in him. There will be people who taunt him. Emotionally, there's no good health. Mental health is spoiled. So, work is a very important thing in our life. It plays a role in promoting the physical as well as the mental health. Physical work is usually associated with improvement in physical capacity. A person who goes to work will be traveling, he'll be physically fit, he works there, so physical capacity will be improved. Goal achievement, self realization, his worth, he can, okay, now he got promoted, now his self esteem rises up, his self actualization goes high, he sets up higher goals in his life. So work plays an important role in self realization, self actualization in work, and are a source of satisfaction, and it also enhances the self esteem. Once he does the self realization at his workplace, he gets a satisfaction. Yes, I'm a member of this company. I am at this post. I play a productive role in the society. I am taking care of my family. I'm a good person. All such things, which will enhance the self esteem. Vocational dimension of health can be assessed. Now you're assessing the vocational dimension by assessing his satisfaction at the level of his job, the facilities which are attached to the job, and the behavior of the management and the administrator and of the colleagues at the job. All such things will determine the vocational health and the vocational dimension of health. There are other few dimensions of health which are mentioned. Those are philosophical dimension. So we have a philosophical dimension, cultural dimensions, different cultures, different religions, different cultures. We have enriched cultures which are present in India. We have socio-economic dimensions, higher socio-economic status, good health, we can say they have a better access to the medical facilities, and then good education, good economic status, and good health. Poor socio-economic status, lack of sanitary facilities, slums, and the area where they reside in won't be that hygienic, which can increase the chances of getting infections. We have educational dimension. So guys, we know the education of a woman is very important. Educational dimension, a mother who is educated will have a good hygiene in the house. She will teach her children, she'll educate her children. So the educational dimension is also very important. We have nutritional dimension, different cultures, different nutritions, again the protein rich nutritions, all such important things which we have to deal with in nutritional dimensions, which we'll be dealing in nutrition and health chapter in detail. We have curative dimension and preventive dimension. In curative, we deal with a individual person where you're curing the disease in that individual person, whereas preventive dimension, it deals with the mass. You're preventing a disease in the mass, a large population is involved here. Then we have occupational dimensions, occupational related diseases and so on, which will be again dealing in the further chapters. I hope this is clear. As of now, you just have to memorize the names, that is philosophical, cultural, socio-economic, educational, nutritional, curative, preventive, and occupational. So, with this, we come to an end of the various dimensions of health. I hope the video is clear. If you have any doubts, put it in the comment section. And if you like my video, do not forget to hit the like button and subscribe. Thank you.